Hello everyone, welcome to my channel Physio Pathsala. So let's start a new topic which is transcutaneous nerve stimulation. Also the short form is TENS. So how you can write in university examination for 2 marks question. So that is sufficient for 2 marks question. So let's discuss about and understand about that. What is the TENS? So it is a full form. First you have to write university examination is a transcutaneous nerve stimulation. So what is the meaning of transcutaneous? So a nerve which is present in inside our transverse level that will stimulate and let reduce the pain over there. So what is the definition of our TENS? So a low voltage electrical current for relieve low back pain and nociceptor pain receptors, which is nociceptor pain receptor. If any kind of stimulation and penetration will be occurred by the pin or any kind of sharp object, so there is a nociceptor receptor which is present in our body. They can absorb the signals and send by the afferent fiber into the brain, and we have to feel a pain. So we have uploaded the video of the pain gate theory, and pain gate theory is based on the TENS machine, so we can apply over there to relieve the pain easily. So a condition there where we can use the TENS machine. So the first is definition, condition, what is the working mechanism of the machine, and what is the indication and contraindication, and also the you can make a diagram so you can full marks in your university exam. So let's discuss about that. The condition we have to be use the TENS machine. The first is low back pain, which is also back pain. So there is a radiating pain occur over there, so we can use the TENS machine here. Also the osteoarthritis occur into the knee joint, so we can apply the TENS machine also over there. Tendinitis occur in our any kind of joint which is inflammation is over there. It is like chronic phase, so we can apply the TENS machine also. Fibromyalgia, muscle pain is occur like chronic phase, so we can apply the TENS. Tendinitis, we can write it 2 times. Bursitis, there is a bursa inflammation, so we can also apply the TENS machine over there. Next is a chronic pelvic pain. It also is a pelvic pain by the nerve compression, so we can apply the TENS machine so over the motor points, so they can stimulate over there and reduce the pain. Next is to be diabetes related neuropathy. So diabetes related neuropathy is occur the our lower peripheries, so we can apply also the TENS machine over there so reduce the pain. Peripheral artery disease, any kind of artery disease which is occurring to our lower limb and cause the pain into the radiating, so we can apply the TENS machine also over there. So that is the condition or indication where we can apply the TENS machine. Also we have not write in the sciatica pain, which is also the radiating and the compression of the piriformis muscle, and the L4 L5 reason disc compression can be cause the sciatica nerve compression that will be radiating the pain over either it will be left leg, either it will be the right leg. So also we can apply the TENS machine over there. What is the working mechanism of TENS machine? So let's discuss about that. Electric current stimulation nerve cells that back the transmission of the pain signal. So what is that? Where we can, this is a TENS machine, we can apply that like I take one example which is sciatica. So a nerve passes through this area like sciatica nerve, so which is compressed by L4 L5 disc compression. So here is the placements of the pads of the TENS machine. So it will be stimulate the nociceptor pain and will be not send the signal into the brain. We have also discussed into the previous video into the pain gate theory. It will be close the substantia gelatinosa ronaldi, which is present in our second order neuron, which is a posterior dorsal horn into the spinal cord. So it will be block the signal over here, and the pain nociceptor pain it will not send into the brain, and the pain it will be reduced. And the clinical significance is to be shown into the patient. I have like in hospitals and clinic, I personally observed after 2 to 3 days the patient have to be shown their pain is to be reduced. So the TENS machine is highly preferable into the radiating pain, and which is very useful for relief over there. So transmission pain signal, it will be the electrical current rises the level of endorphin, which triggers your body's pain relieving power. So which is endorphin? It is a natural painkiller which is present in our body. So if you are not adult or old age, so our body's natural painkillers is endorphin. It also helps to reduce the pain signals in our body. And if you are applying the TENS machine into our body, so it will be also trigger the endorphins to reduce the pain into the body. So that is the work mechanism of to the TENS machine. What is the contraindication where we cannot apply the TENS machine into the body though? So the pacemaker which is present in our nearby the heart, so where we cannot apply the TENS machine. Also the cancer patient, there will be a higher chance to a patient not accommodate or like not feeling like burn sensation, so it will be burning over there. Epilepsy patient also, DVT, it means deep vein thrombosis patient, also not applying the TENS machine. The bleeding disorder like hemorrhagic condition, we are not applying the TENS machine. Heart related disease, we are also not applying. Also the metal implant, pregnancy, so we that is some contraindication, we are not applying the TENS machine. So there is a TENS machine diagram. You also write down, make a diagram into the university examination for 2 to 3 marks for university examination. So here is a TENS machine. You can write down the channel one, channel one. This is channel two and channel two. You can write, make a diagram into university. Then you can make a gel over there. So if you can identify the patient applying gel over between the pad and into your body surface, so that it easily pass the electrical signal which helped by the lubricant. And take one example for the good marks for the sciatica, which is here, and that will be reduce the pain. So that is the 2 marks answer or 3 marks answer you can write in university examination. Thank you.